We are continuing our discussion on the coronavirus or COVID-19 pandemic. And with new case numbers increasing again throughout the country and here in Orange County, where we are continuing to record high numbers of new COVID cases due mostly to the Delta variant, many residents are questioning what we should do next. Orange County government is suggesting that all residents wear face masks again while indoors. So what does all of this mean for you? Well, on this special edition of Healthy Connections, we're going to get an up-to-date look at where we are as a community dealing with this pandemic. Let's get an update from our state medical professionals, and joining us is Alvina Hsu, epidemiologist with the Florida Department of Health in Orange County. Alvina, thanks for joining us as always.
Thanks for having me again.
So Alvina, tell us where we are in both Orange County as well as the state of Florida as it relates to COVID cases.
So currently still quite high. And so I think the last time we spoke, we were at the high level or the red level of transmission, which indicates high community transmission. So we're currently at greater than 500 new cases per 100,000 population, which is above the threshold for 100 new cases per 100,000 population. And our percent positivity over the last 7 days, the average is approximately 19%, where the threshold for that to be considered in a high level of transmission is 10%.
Wow. So
positivity for tests.
What's behind those numbers? Why are they going up so quickly?
So it's kind of a perfect storm, and so it's a little bit hard to say, specifically one thing is there. We get asked that a lot, like why the peak now? What's the crystallizing event? So not necessarily a single event, but sort of an accumulation of things. And so one part of that is potentially waning immunity from the first time that the virus first came around, and also potential waning immunity from the initial vaccinations. Also, a return to what we had thought was normalcy. So in June, we were at the lowest levels we had seen since the beginning of the pandemic. And so, we scaled back on a lot of the precautions that really kept the virus in check previously. And then the unvaccinated proportion, we still haven't been able to get a sufficient level of community immunity within Orange County, and also the Delta variant. And so development of a new variant that has been able to that has been found to be incredibly infectious and can spread very rapidly with high levels of virus in each infection.
And I want to key in on something you said about waning immunity. Is the vaccine actually losing its efficacy over time? Is that what's happening? So
that's one small part of it. Efficacy is basically studies that show what is the reduced amount of infections in a vaccinated population compared to an unvaccinated population. And so the reasons why there might be decreased efficacy could be a couple of different factors. One factor is, losing potentially or a decrease antibody response that sort of wanes over time, and this has been known to happen with other vaccine preventable diseases that we have, which is why there's sometimes several year boosters, or sometimes there's yearly boosters. So it depends on the vaccine type and the organism that you're trying to protect against. So one part is potentially waning immunity. One part is also the development of variants. And so as we discussed before, the vaccines were developed to protect us against a specific, say, viral configuration. So a certain number of proteins or certain types of proteins on the outside of the virus. And as every new infection allows the virus to mutate, there's the potential for a virus to develop some or gain some advantage that would have it evade the immunity that we have developed either through vaccine or through natural infection from previous viral exposures. And so it's a combination of those kinds of factors.
And now that we have full approval of the Pfizer vaccine by the FDA, and people who may have been waiting for that milestone, where can people get a vaccine now?
So we were really excited to hear on Monday about the full approval for the first COVID vaccine for the Pfizer, which is, we'll say first, fully approved for those who are 16 years of age and older. The emergency use authorization is still in effect for those who are 12 to 15. However, 12 to 15-year-olds still can get the Pfizer vaccine. So there's over 120 locations you can get the vaccine within our county, and that includes all of our retail sites, as well as including the public vaccination sites that we have. And so just to remind people, the vaccine is free for everyone, regardless if you get it from a public site or from a retail pharmacy.
And you know, school is back in session and everybody's thinking about the kids and how they're going to be affected going into a classroom. Do you find that from an epidemiological perspective, that the numbers that are being reported of the cases of children who are coming down with COVID are being accurately reported?
So we are working with Orange County Public Schools to conduct contact tracing and identify those who are positive and identify those who are recommended for quarantine. Recently, in the peak numbers of cases that I had recently mentioned, just over in the last few weeks, the age group that has contributed to the highest proportion of new cases has sort of shifted down to 5 to 14 years of age. And so today, for the data reported from yesterday, 22% of all new cases were identified in a child who was 5 to 14 years old. The day prior to that, it was 20%. And so this has been a little bit of a change in the demographics that what we've seen over the beginning part of the pandemic. So you mentioned as far as accuracy goes, so we are getting reports of staff and parents related to Orange County Public Schools who are experiencing illness. And so we try to confirm the lab results as much as possible, but then also wanted to remind people that regardless if you have a lab confirmed illness, if you are sick, you should not be in school or in public and really should isolate at home. Essentially, in this high rate of transmission that we have in our community, it's pretty much assumed to be COVID until it's proven not.
So I know that children under 12 years old are unable to get vaccinated, but how about the 12 to 17-year-olds? How are we doing when it comes to their vaccination rates?
So currently, just a little over 52% of those in the 12 to 17-year-old age group in Orange County have been vaccinated or have at least received one dose. And so we're encouraged that it's over the 50% mark, but would like to encourage those who are eligible, all those who are eligible to receive the vaccine, to receive it so that we can help reduce the transmission, particularly in our schools.
And if you can, tell us a little bit about how virulent this Delta variant is and what really is and how it's different from how we started out this pandemic last year, and the big differences in how the Delta variant is moving.
So a couple of studies that were published recently within the last few weeks have shown that the Delta virus can be at least 2.5 times more infectious than what we previously knew from the original or the wild type strain. And so whereas the original strain would infect what we thought it was somewhere between 1 to 3 people, now the Delta virus can infect somewhere between 5 to 7 or 5 to 8 people. So that is a significant increase. So it's more contagious. And recent studies have shown that you carry a higher viral load. And so you can have an infection that's up to 1,000 times more viral copies in your respiratory tract during a symptomatic infection than with the original strain. So you carry more virus and you're able to spread it faster.
That's why it's important to get vaccinated and wear a mask.
And practice all the other pandemic precautions. Every layer helps. So the physical distancing, as well as the hand hygiene, as well as the wearing of masks.
Exactly. Well, thank you so much, Alvina, for being with us and keeping us informed from the front lines of this pandemic. We appreciate your time.
Thank you so much.
And we'll be right back with more. Stay with us. As new COVID-19 case numbers continue to rise, due mostly to the Delta variant, hospitals are taking the major brunt of the impact. And Dr. Vincent Hsu is Advent Health's infection control officer. He's here to tell us more about what's happening. Dr. Hsu, thanks for being with us today.
Thank you.
So tell us where we are as far as the condition of emergency rooms right now. Are they still overwhelmed?
Yes, it's still pretty intense here. We are seeing a flattening of the number of COVID patients, but we are still very, very close to our peak. Unfortunately, all the ICUs still remain extremely full. We're 100% full, and there are patients in the ICUs that are actually not in an ICU bed. They actually have to be in other rooms to be taken care of. And we do have, unfortunately, in the hundreds right now of people in the emergency department that are waiting for beds or ICU care that have to wait in the emergency department until there is a bed available. So we're very happy that we may be hitting a peak in terms of the number of COVID cases, but there's still a huge backlog that we still need to navigate probably for the next few weeks.
You know, on Monday of this week, I had the unfortunate circumstance of watching one of my neighbors being taken out by ambulance, and I am assuming it is probably COVID related. Unfortunately, what would a patient experience once they get to the hospital and they come into the emergency room?
Well, for COVID patients or patients who have trouble breathing, I mean, they do need to go to the emergency department. And I can assure you that we will be taking care of these patients the way we would under normal circumstances, assessing their vital signs, making sure that they have enough oxygen to cope with what's going on, and then providing them any medications that are available to help treat COVID disease. And then after making sure that they're stable, we do want to make sure that they're able to go into a room that upstairs in the hospital where they can be taken care of.
You know, late last week, the city of Orlando was asking residents to reduce water consumption due to oxygenated water. So can you explain why the hospitals need extra water?
Well, so the issue is liquid oxygen. Liquid oxygen is really what is being used liquid oxygen is being used for the hospitals, and then it is then converted into regular air grade medical oxygen to provide for your patients. And hospitals require a certain amount of liquid oxygen in order to provide oxygen in the hospitals and to fill containers that can be used for patients outside the hospital as well. This is the same oxygen that's being used for OUC, for the utilities, to purify their water. So when you're dealing with increased demand from hospitals for liquid oxygen, inevitably that will cause a certain amount of pressure and shortage that could occur if there are other facilities that need to use it, specifically utilities.
And we just learned that the FDA has fully approved the Pfizer vaccine. Can you reiterate the importance of getting that vaccine so that people do stay out of your emergency rooms?
Yes, it's really good news that the FDA has full approval for the Pfizer vaccine. And that really means that they've looked at data that goes above and beyond what is required for emergency authorization. So they've looked at the full scope of data and determined that at this point, given what they've seen, that it really meets the criteria for full approval. But we've known this for a very long time already, that the vaccine is absolutely our key to getting out of this pandemic. It is safe, it works, it will prevent or reduce your risks tremendously of having to have a severe illness, going to the hospital, or of death. Yes, vaccines do have side effects. Most of them are very mild. There are rare cases of serious side effects that do occur, and those are listed on the package labeling. And if you have any questions, please talk to your doctor. But given the surge that we have right now, given the amount of of death and severe symptoms that and the transmission of COVID that's going on in the community, your best bet is to get the vaccine to protect yourself and to prevent spread to other parts of the community.
And we're hearing just a little bit about these breakthrough infections, which is, for those who don't know, which is when someone who is vaccinated has actually gotten COVID, for instance. Does that mean that the vaccine's efficacy is waning?
So we've seen, yeah, so we have seen that over time, and partly because of Delta variant. So we know we have a Delta variant that is more infectious, and in which it may be somewhat more resistant to vaccines. We are also seeing some data now that over time, and we're talking about more than 6 months, something like 8 or 9 months, that the efficacy of the vaccine can wane over time. So yes, we are seeing some breakthrough infections. But the good news is that it still has significant efficacy. It still works to a very large degree, and especially against severe infections such as that requires hospitalization or complications that lead to death. It still is very protective. And so even though we do know breakthrough infections do occur, your chances of doing better are much better by getting the vaccine than not having it at all.
It's definitely better than nothing, for sure. Recently, Dr. Fauci was on an interview, being interviewed, and he said that it could be the spring of 2022 before we start to see the light at the end of this pandemic tunnel. Do you agree with that?
I think there's a lot of factors that have to be considered. We do have to consider the possibility that new variants could emerge, and so we'll have to see what happens with that. We still have to vaccinate a significant part of the population, and given that Delta is more infectious than what we've seen with the other more wild-type variants, it will require vaccinating even a larger group of the community in order to achieve that herd immunity. So I think that for the foreseeable future, we are going to have to deal with COVID in one form or another. But the key really is to manage it. And unfortunately, right now, over this summer, and the fall, it is not sustainable for the way the healthcare system is right now. We've got to get we got to be able to keep patients out of the hospital. And develop. We also need to develop new therapies for this, but we can certainly, hopefully, be able to manage it. And I am optimistic that sometime next year we'll start getting a better handle on this virus.
And you mentioned just, the unsustainability of the current situation. How does a hospital handle some of the other things that happen on the normal basis? Somebody comes in having chest pains or somebody breaks an arm. Does that now start to compromise some of the other reasons people go to the hospital?
Well, we hope that's never the case. I mean, at some point, the hospitals do have a breaking point where if there's just too many patients that can be that have to be taken care of, that inevitably there could be concerns about quality of care, and that includes those who don't have COVID as well as those that do have COVID. Advent Health has a significant surge capacity plan to be able to deal with this. We recognize that with shortages of staff, such as physicians and nurses, they have to be stretched a little bit. There are models in which we can provide the care that allows fewer staff to take care of patients in the best way possible. We have plenty of personal protective equipment currently, but we have to make sure that we are using all our resources as wisely as possible, such as ventilators, which are in very high demand. And we have to be creative with spaces. So as mentioned earlier, not every ICU categorized patient is in an ICU designated room because there just aren't enough, but we are able to take care of ICU patients in other rooms, again, with the staff and with the equipment that we have. So we are resilient, and hopefully it doesn't have to resort to to worsening crisis standards of care. And so that is our hope, is that while we are stretched, we are not broken. And we hope that with the number of cases going down, that we'll be able to get through this.
Well, we certainly appreciate all of the people who work in healthcare, trying to keep us safe, trying to keep us healthy. And we appreciate your time today and keeping us informed from the front lines of this pandemic. Thank you so much.
Thank you.
And we'll be right back with more. Stay with us. AARP's COVID-19 dashboard was recently updated with new data from the federal government. Now, this research data shows that Florida has the highest percentage of nursing homes reporting new cases of COVID-19 among its staff, and the second lowest vaccination rates for nursing home staffs. So, AARP Florida has called on the state to require vaccinations for nursing home staff and residents, and the Biden administration announced last week that the federal government would answer that call. Joining me is Jamie Champion Mongiovi with AARP Florida. Jamie, thanks for being with us today.
Thanks for having me, Clarence. It's great to be here.
So we talked about the federal data in the open. What is that federal data telling us about COVID in Florida?
Sure. So what we're seeing currently is a slight uptick in the number of cases among not only staff in nursing homes, but also residents. And so we're monitoring that closely. We've been doing this since June of 2020 when we launched the dashboard. And so we have over a year of data that we've been tracking from the Centers for Medicare and Medicaid Services. And so right now we're monitoring cases. Thankfully, deaths have remained low. They are still occurring, but much lower than what we were seeing the same time last year.
And some look at this data and think that it's alarming. Why is it so alarming, especially here in Florida?
Sure. So I think that that's a great question. We have roughly 25% of our population as folks who are older adults, 65 and older. When we say older adults, that's what we mean. And so it's alarming because over the course of the pandemic, we've seen roughly 12,000 people die in Florida's long-term care system of COVID. And so I think what we're seeing now as vaccinations have become available, and we're looking at how that has been rolled out in the state. We were expecting the pace at which these facilities would vaccinate their staff to be much faster than it has been. When you look at where we were in April at roughly 38% of nursing home staff vaccinated, and where we are now, current data that's a little more recent than the most recent dashboard shows us that we're right around 47%. So we haven't made that leap to the industry standard, which is 75% plus staff vaccination. And that's where we need to be if we're going to continue, if we're going to prevent the spread of the disease in these facilities.
And with those data points, what are some of the challenges that we're starting to see inside of nursing homes?
That's a great question. So many of the challenges that we have seen during the pandemic in these facilities were present long before. They've never been great at infection control. And when you have people who are unvaccinated and in close contact with very vulnerable residents of nursing homes, that creates a high-risk environment. And so the deaths that we've seen coming from these facilities during this time have been, in some way a direct result of that.
And the Biden administration has announced that it is going to require vaccinations for nursing home staff in order for the nursing homes to continue receiving funds for Medicaid and Medicare. What does that mean to nursing homes?
Sure. So when we see the rules roll out in late September, we won't really know until we see them and know what that mandate will require fully. But what has been announced is that Medicare and Medicaid funding could be withheld from facilities who do not mandate vaccination for their staff members. And currently in Florida, roughly 80% of a nursing home facility's funding comes from either Medicaid or Medicare. So, we're talking about a vast majority of the money that is used for those facilities potentially being unavailable if they choose not to vaccinate their staff.
And is there a time frame for implementation of this order?
So it's been announced that it could happen as early as September, and so we're looking towards September.
So until we get to that point, are there currently any kind of regulations in place or restrictions in place for staff or who can visit or for residents who are being admitted to nursing homes?
So currently that varies by facility. So it really depends on where you are. We've been encouraging families that have contacted us to get in touch with the facility where their loved one is residing and make sure that they're in communication to know, are there COVID cases that have been reported by the facility? What is the status of staff vaccination at that facility? And what kind of safety measures are being taken to protect their loved ones?
And we've been talking about nursing homes, but how about assisted living facilities here in Florida where people have a lot more mobility and they're moving in and out of, just on their day-to-day going out? What's happening there?
So right now, that's kind of a black hole for us when it comes to having data and knowing about what is going on with COVID-19 in assisted living facilities. There are roughly 4 times the number of assisted living facilities that there are nursing homes in Florida. We have about 700 nursing homes, and we have roughly 4,000 assisted living facilities. And the state of Florida stopped reporting data on assisted living facilities in June. And so since that time, we haven't had, a way to monitor what's going on inside those facilities.
So how would you suggest that someone who has a loved one who's in a nursing home or assisted living facility, how would they get information about what's happening inside that facility?
Absolutely. So I would suggest contacting the facility administrator or the director, or if you know which staff members are in close contact with your loved one on a daily basis, if you can talk with them, that's obviously the best case scenario. If you're not getting the information that you need, you can always contact Florida's long-term care ombudsman through the Department of Elder Affairs. You can call the Elder Care Helpline. If you feel that your loved one may have a more immediate need or be in danger, you should certainly contact Adult Protective Services at the Department of Children and Families to ensure that you have filed a complaint. If you have a complaint against the facility itself, the Agency for Healthcare Administration is charged with the regulation of long-term care in Florida, and so you can always file a complaint with their office.
And for those who are unfamiliar, what kind of information would you find on AARP's COVID-19 Dashboard?
Absolutely. So we have a very user-friendly dashboard available where you can go and actually hover over your state to see immediate statistics, or you can actually download data tables if you really want to slice and dice the data to take a look at it. But we are covering deaths, cases, staffing shortages, the availability of PPE, and that type of information.
Well, Jamie, thank you so much for being with us, and also thank you for the work that AARP is doing to keep us informed about Florida's most vulnerable residents. We appreciate your time.
Thank you so much, Clarence. It was great to be here.
And we'll be right back with more. Stay with us. We've heard from a variety of leaders today trying to keep us informed about the coronavirus. From local government, the medical community who's on the front lines dealing with this pandemic, and organizations who continue to serve this community. And of course, we are also here to help you keep making those healthy connections. Stay safe.